This video goes over how to perform trach care and suction using a closed suction system.
Hi, I'm Madison and I'll be your nurse today. Let me wash my hands.
Proper hand hygiene is important in preventing infection in any patient, especially patients with tracheostomies, as they are already at a higher risk for upper respiratory and lower respiratory infections. You should always wash your hands and/or use the foam on the door before providing any type of patient care in any setting you may be in. It is important to identify your patient before providing any care. This is especially important in a patient who may not be able to communicate verbally. Always check the armband and ask the patient for their name and date of birth.
Roger Barrington, 4/15/1987. I'm just going to shut this door to give us a little more privacy while I perform your care today.
Always provide privacy to your patients to help them feel more comfortable during care and to keep their care, private. Assess your patient's pain, respiratory status, O2 saturation, lung sounds, and need for trach care.
Okay, Mr. Barrington, I'm going to explain what I'm going to do today, and then I'm going to perform your care. First, I'm going to start by suctioning your airway to make sure that your airway is patent and there's no extra secretions in your tracheostomy tube. Then I'll be performing trach care. This includes cleaning the skin around your stoma, changing out your inner cannula, and also cleaning the plate and changing the necktie. So before I suction your airway, I'm just going to give you a few extra breaths. That way your oxygen saturation won't drop to a dangerous level while I'm performing your suction.
By providing your patient with extra breaths, you are hyperventilating them, keeping them from becoming hypoxic during suctioning, since their airway will temporarily be occluded. While suctioning, you should never suction for longer than 10 to 15 seconds and always allow for a 30-second rest period in between each suctioning session. Never suction more than 3 times during a single session. In real life, this cannula will be connected to wall suction. Pressure for an adult is between 100 and 150. Neonates is between 60 and 80. Infants and children is between 80 and 125, and adolescents is between 80 and 150, depending on the size of your patient. When using a closed suctioning system such as this, be sure to always visualize that the end of the cannula has been fully retracted out of the tube. If it's not, your patient could experience respiratory distress. This is much easier to see on a real patient with real equipment, as there is a black line on the end of the suction cannula in the closed suctioning system to let you know where the end of the tube is. The next step is to change the inner cannula on the patient. Be sure to open the new cannula and maintain the sterility of the package. In real life, this would be in a sterile package and not bubble wrap. Put on clean gloves and remove the patient's oxygen source if indicated. Remove the old inner cannula. Change your gloves and put on sterile gloves to put in the new inner cannula. Be careful not to dislodge the trach itself while performing this step. Connect the patient back to their oxygen source as soon as possible. Next comes setting up your tray for trach care. This tray typically includes a drape, a set of sterile gloves, a sterile normal saline bottle, several 4x4s, a drain sponge, a brush, cotton-tipped applicators, and hydrogen peroxide. Be sure to put on the sterile gloves before touching anything inside the sterile field. Open the sterile saline and pour it into the basin. This will be used to clean your patient's skin and the plate. Alternatively, you can use the hydrogen peroxide to clean the patient's skin and plate. Next, you will begin to provide skin care to your patient. Start by getting a cotton-tipped applicator and dipping it in the normal saline. Then, starting at the area closest to the stoma, use a cotton-tip applicator to clean from the stoma outward, using one cotton-tipped applicator per swipe. Remember to always clean from dirtiest to clean to prevent infection. Next, you will grab a 4x4 from your sterile field to dry your patient's skin. Pat the patient's skin dry to prevent skin breakdown and to keep your patient's skin from becoming too moist. Next, it's time to clean the plate. Grab the brush from the sterile field and dip it in the saline. Gently scrub any dried secretions from the plate. Never use this brush on the patient's skin. Next, grab the drain sponge from your field. Remember to never cut your own drain sponge, as your patient may aspirate on any cotton pieces that can become loose and enter their airway. This sponge will help collect any secretions that come from the stoma and prevent them from staying on the skin. Anytime this becomes soiled, trach care is needed. The final step is to replace the patient's necktie. For this step, you will need a second assistive personnel. I did this by myself for the first time to show you how difficult it can be to perform this step on your own. It is much easier with two people. As you will see, I actually ended up breaking my tracheostomy tube in the process of trying to do this myself. You always want to make sure that you have enough room for 1 to 2 fingers between the necktie and your patient's skin to ensure that you are not choking your patient. Be sure to check your facility policy on what type of securement device to use for your tracheostomy tube. Some facilities still use the necktie seen in this video, and others use Velcro neckties. As you can see, trying to do this myself, I'm really struggling to get these knots untied. I'm also struggling to hold the plate in place to prevent it from becoming dislodged. In real life, if I were to have a problem, this patient's tube probably would have become dislodged. As you can see there, the tube broke. This would be an immediate concern for the patient. I played it off and acted like nothing happened for the sake of the video. But in real life, if something like that were to happen, you would want to stop immediately and call for help. Remember to always have a spare tracheostomy tube at the bedside in case something like this happens. I tried this step again with the use of an assistive personnel. As you can see, I'm having a much easier time working with the necktie in order to change it in an efficient manner. Especially with this type of necktie, the use of an assistive personnel is helpful because this type of necktie is particularly difficult to get off. The use of an assistive personnel can also prevent the tube from becoming dislodged while the necktie is being changed, especially on a patient who's on a ventilator. While I did not fully retie the tie back you would in real life, I simply was struggling too much trying to get the tie back through the holes on the tube. It is important to reassess your patient's pain, respiratory status, lung sounds, and O2 saturations after performing these skills. You will then want to remove PPE, wash your hands, and document the date, time, what you did, if there was any drainage noted from the stoma, and how the patient reacted. Trach care can be intimidating to some, but with practice, it can become easier with time. Some things to remember are to keep a spare trach at the bedside, a bag valve mask at the bedside, any care supplies needed, and if your patient is conscious, this care can be performed in a semi-Fowler's position. However, if your patient is unconscious, lay them flat and position their head towards you.